Well, thanks for tuning in to talk about this important issue. I know how busy everyone's lives are. My name is Evan Saulino, and I'm a family physician. And I've seen the state of healthcare worsen during my career, but I wasn't motivated to action until I lost two of my patients in 2006. Despite working full-time, neither had health insurance, and they died because they lacked access to affordable care. After their deaths, I began to investigate and fully understand the flawed and harmful direction of healthcare in America. And I began to realize that even I, as a doctor, cannot ensure that my two children will have access to medical care in the future. That's why I joined with my colleagues at Doctors for America to help shape a healthcare system that works better for all Americans. Now, if you've paid attention to the federal healthcare debate over the last year, or even if you haven't, you realize that healthcare in America is really quite complicated. But today I'm going to try and boil it down into just a single slide, and this is it. So the question is, what is this? What does this graph represent? Common answers are healthcare costs, the number of uninsured, deficits, taxes, things like that, and it turns out all of these are right. This slide shows us the true cost of doing nothing. The United States already spends 2 to 3 times what any other nation does on healthcare, and costs continue to skyrocket 200 to 300% faster than wages or general inflation. In 2009, American families already were spending nearly $17,000 per year for healthcare and coverage, or $1,400 per month for many of us rent or a house payment. So this curve represents the cost of your insurance premium, copays, and deductibles. This curve represents the number of uninsured Americans. Over 47 million Americans don't have health insurance coverage now, and it's estimated another 14,000 lose their health insurance every day in the current recession. The curve could also represent the number of Americans who are underinsured. A 2007 Consumer Reports study showed that 72 million Americans have bare-bones coverage, too flimsy to protect them or their family from major medical expenses. And we all see each year that although we pay more, our benefits keep shrinking. If you turn this curve on its side 90 degrees, it could represent the enormous financial drag our dysfunctional healthcare system is on the general economy. Businesses who try to do the right thing and provide health benefits for employees find themselves at a competitive disadvantage. Many have to choose between hiring more employees or paying for the latest insurance premium increase. 5 businesses drop health insurance every hour in the United States, and if costs continue to rise unabated, this trend is sure to continue. So this curve could represent the number of small business owners offering health benefits to employees. The curve could represent the money you have available after healthcare costs, taxes, and other necessities of life. Research shows already 50% of all bankruptcies are due to medical bills in the U.S., a phenomenon unheard of in other industrialized nations. And the curve could represent the public dollars available to spend on other important things like roads, schools, parks, or the dollars left in the Medicare Trust Fund, which is projected to run dry in 2019. So it's not surprising that more than 8 out of 10 Americans agree our healthcare system needs major change. Recognizing the imperative, federal legislative leaders made healthcare reform their #1 priority in the spring of 2009. Now, I have to say, as a physician, I'm upset at the tone the federal health debate took on. I don't think healthcare is a Republican issue or a Democratic issue. It's an American issue. The use of divisive messaging and misrepresentation of facts led us away from important conversations about solutions, and instead baited us into arguments with our fellow Americans. Despite this unfortunate turn of events and vile opposition, healthcare legislation slowly progressed on a long and twisted path in the glare of the media and public spotlight. Finally, although it didn't end up like I would have written it, a healthcare reform bill was signed into law in March of 2010. Now, I'm sure many of you have heard people talk about the new healthcare law and what it means, and it's hard to sort out fact from fiction. But I'm here today to tell you what's really in there and to explain why our journey has just begun. Much of the meat of the new law focuses on reforming health insurance by providing for expanded coverage, offering more affordable insurance, increasing insurance company regulation, and trying to foster more responsibility across the healthcare marketplace. However, there are also elements that target some of the more fundamental problems in American healthcare to control costs and improve care in the long term. These include the recognition that primary care and prevention play a critical role in keeping Americans healthy. There's also support for payment innovation to improve the value we get for our money, and efforts to begin training more of the medical professionals we need. It's projected that the new law will result in over 30 million more Americans with health insurance coverage. Medicaid, the federal program that acts as a safety net for many low-income Americans, will be expanded to 133% of the poverty level, which is about an annual income of $26,000 for a family of 4. That will be financed primarily through the federal government. Another way the new law expands coverage is by offering subsidies to small businesses and individuals to buy private coverage through a regulated marketplace called an insurance exchange. These exchanges will be state rather than federally run and will act sort of like supermarkets for health insurance, with consumers offered options and prices that allow for comparison shopping. Unlike the current insurance market, which leaves many Americans powerless and exposed, in an exchange, the customers should have choices and pooled buying power. This means insurance companies have to compete on a more level playing field, and they cannot cherry-pick which Americans they choose to be their lucky customers. This injection of competition should improve efficiency and customer service, which are valued in the general economy but frequently lacking in the insurance marketplace. Additional government regulation of participating insurers will include defining a minimum benefit package or a lemon law for health insurance. This will prevent insurance companies from selling policies that fail to offer the coverage you need. And customers who might want a Mercedes instead of a Honda, for example, would have the option of buying up for more comprehensive coverage. The exchanges will be open to Americans who don't have health insurance, small business employees, and some employees who cannot afford the insurance their employer offers. Importantly, members of Congress will have to purchase their health insurance through these exchanges as well. These will be up and running in 2014 or sooner in some states that are pushing for earlier implementation. Now, the key to success of this plan for coverage expansion is that insurance in the exchange must be kept affordable. Right now, millions of American families and businesses are being squeezed tighter and tighter by the vice of unaffordable health care costs. Although using market methods and long-term cost savings measures will help, it's clear more needs to be done. Recognizing this fact, in addition to small business tax credits, the new law will include sliding scale subsidies that can be used by individuals and families to purchase insurance in the exchange. These are set up so that families should not have to spend more than 9.5% of their annual income for health coverage if they make $88,000 per year, and would spend less than 2% if they're at the low end of the income spectrum, but make more than the new limits for Medicaid coverage that I mentioned. Everyone will pay according to the resources they have, but everyone pays something. Now, it's clear to most Americans that the balance of power in today's health insurance market does not favor patients. Although the exchange will help those participating in it, more comprehensive regulation is needed to stop unfair insurance company practices and provide fair protection for those who get their insurance outside these exchanges. With the new law, pre-existing condition exclusions will be outlawed, and insurers will no longer be able to drop or rescind your coverage when you get sick. Insurers will no longer be able to discriminate against women by charging them higher premiums. Lifetime limits for coverage will be prohibited, and out-of-pocket costs will be limited. Putting patients before profits, the law also requires that insurance companies spend at least 80 to 85% of each customer dollar they receive on actual medical care. This will be an improvement over the current average of 25% spent on paperwork and profits today. These policies will also be fully implemented by 2014. Now, I've been talking a lot about policy, but what does the law mean for actual Americans? I want to give you a concrete example. Irene was a hardworking American in her 40s. She'd been married for 20 years and had 3 children. She just moved from a job without benefits to a new one which paid better and offered health insurance after 6 months of employment. Her future was looking bright. Then she began to experience symptoms she knew were not normal, but she put off coming to see her family doctor because friends had warned her about pre-existing condition exclusions. She was afraid treatment for her problem, whatever it was, would not be covered by insurance if it was discovered before her coverage officially started. She thought she could wait the 6-month probation period and then go to the doctor. She was wrong. Her cancer caught her first. Irene died with her family at her side in October of 2006. As a physician, I can't say for sure if we would have kept Irene alive with her family for longer or if we could have possibly even cured her if she had come in earlier. But I can say we would have had the chance. With this new law, we can look forward to a time when stories like Irene's only exist in our history books. Now, let's talk about responsibility. Part of making the insurance reforms in the new law work relies on minimizing free riders in the system, making sure everyone has skin in the game. Right now, you pay for those who are uninsured every time they go to the emergency room for care they can't afford when things get really bad. This unfortunate situation often results in medical bills that are passed on to consumers like you and businesses who pay for insurance as a hidden tax to the tune of over $1,000 per family health insurance policy every year. When the new law kicks in, subsidies and tax credits should help nearly everyone to afford insurance coverage. No one has to buy insurance, but if they choose not to, they shouldn't get off scot-free while the rest of us have to pay for their unplanned emergency care. The people who choose not to buy insurance will face a tax or a penalty, which has been termed the individual mandate. Much like state car insurance mandates, this measure should help drive down costs, particularly by encouraging young, healthy people to stay insured. Not only individuals, but business owners also must begin to share responsibility and move from the current situation where employers who don't offer health coverage are actually at a competitive advantage compared to those who do. To level the playing field for all employers, those who don't offer health benefits and then have employees receive public funds in exchange subsidies or Medicaid will pay a penalty. This should help ensure those employers do not leech in a competitive advantage off of American taxpayers. Small businesses with fewer than 50 employees are exempt from these penalties, but as I mentioned on the exchange slide, small businesses will receive tax credits that actually start this year and will be able to participate in these exchanges, which again will allow them to pool their purchasing power and drive down costs.